I was riding around the park, couldn't focus, I was tired, got off my bike, and that was it.
52-year-old David Miller knew something was wrong when he had trouble getting through his usual lunchtime bike ride.
Mr. Miller was experiencing transient ischemic attacks, or TIAs, we call them, mini strokes. He didn't know it, but he was in a lot of trouble.
Fortunately for David and his family, his local hospital is part of the Michigan Stroke Network. Despite its remote rural location, he received timely diagnosis and treatment there from a highly trained specialist through the use of an innovative robotic communication system. The Remote Presence System from InTouch Health brings specialty expertise to network emergency departments whenever or wherever they need it.
Remote presence is really a technology that enables someone to be in two places at once, using robotics and wireless and the internet to project someone so that they're really at another location and they can instantly be at their patient's bedside regardless of where they're physically located. It's really about the ability to extend the workforce that we have to be able to deliver quality care instantly across a much larger geography.
Getting expert call panel coverage to emergency rooms is a growing challenge for hospitals throughout the nation.
We project a shortage of specialty physicians. Technology is the solution. This is one of those technologies.
This gap in healthcare is particularly acute when it comes to stroke due to the narrow time window for proper diagnosis and care. Stroke is the third leading cause of death and the #1 leading cause of major disability. A call to 911 soon brought the Miller family to the local emergency department in Port Huron. There, David's emergency physician began assessment and placed a request for a remote presence consultation with an MSN stroke neurologist at St. Joseph Mercy Oakland Hospital in Pontiac, more than 50 miles away. Within minutes, the on-call neurologist in Pontiac connected remotely via remote presence to the Port Huron ED.
It's easy. 3 clicks and I'm connected to the emergency department at Port Huron. It's like being there. Within seconds, I forget I'm in the next county.
Our average login time is 6 minutes, so we can respond across a large geographic distance within moments, often faster than a consultant could respond from the same hospital. We offer nothing more than immediate access to stroke expertise 24 hours a day, 7 days a week.
Remote presence consultations mean that patients get the care they need when they need it.
We see that we actually deliver TPA, the clot-busting medication for stroke, at a rate of 50 to 60 times the national average through the stroke network.
InTouch Health's remote presence system offers unsurpassed mobility, reliability, visual and auditory acuity.
I never thought be assisted in caring for a patient with a robot. Technology is advancing where we can get the robot to examine the patient's pupils and tell if there's a problem, so it's very gratifying.
With SureConnect, every remote presence interaction is continuously supported by InTouch Health's technical and clinical teams. This secure combination of broadband, internet, and wireless technology results in powerful and highly reliable real-time communication.
Our concern was around the acceptability of robotic communications with the patients. That has not been an issue.
One of the most compelling aspects of the Michigan Stroke Network is how use of the InTouch Health remote presence system fosters alliances with community partners. By diagnosing and triaging only the sickest patients to a tertiary center, the patients who can receive care in their own community.
This program keeps 70 to 80% of those patients in those local communities. Now they understand they have a partner who wants them to win while we take care of people in an enhanced manner.
Don't look at it as you're investing in only one particular application, but just about any application or any service within a hospital. You can utilize this technology to extend the reach of your specialist and the access for people that never had it before.
This technology allows me to help more people than I ever could have helped I can actually help people as far away as 300 or 400 miles or half a world away, and there's no difference.
Today, David continues rehabilitation from his stroke.
Go on, guys. About 25 years ago, my dad had a massive stroke after his surgery, and they wrote him off at that time. I feel very blessed that this has turned out so well for me.